Hi, I'm Dr. Maya Artandi, and today I'm going to demonstrate a 10-minute moment for back pain. The 10-minute moments were created to help assess physical examination skills. They contain a faculty development part and an assessment part. Assessment and giving feedback are integral parts of medical education. We are all very busy, thus assessing and giving feedback on a learner's physical examination skills should be easily integrated into the clinic flow or inpatient rounds in the hospital. Taking a good history is important and greatly aids in making the correct diagnosis. However, the 10-minute moment is specifically used to assess physical exam skills only. It does not include history-taking skills. Let's get started. This patient comes to the clinic with back pain radiating down the left thigh. Your learner is tasked with doing a physical exam to decide on further management. The initial step in evaluating a patient with any physical concerns is to observe the patient. Is the patient in obvious pain? Were they able to walk to the examination room? Were they using crutches or even a wheelchair? Do they look ill? The next step is to do a structured back exam. The structured approach to the back exam in a patient with pain radiating down the leg includes inspection, palpation, range of motion, provocative maneuvers, and a neurological evaluation. You do not need to do a neurological examination in a patient whose pain is limited to the back and does not radiate down the legs. The learner has to make sure that the patient is safe during the exam and, if necessary, needs to assist to prevent the patient from falling. Hello, I'm Dr. Artandi. It's very nice to meet you. May I examine your back, please?
Of course.
Can you please stand up and turn your back to me? May I lift your shirt up?
Yes.
It is really important that your learner looks at the back without it being covered by clothes. Otherwise, they might miss a rash, bruises, scars from prior surgeries. Also, one cannot assess the curvature of the spine without looking at it directly. Look for scoliosis, exaggerated kyphosis, or lordosis. The next step is palpation. What I notice is that many of my learners just palpate too softly. This will not elicit any pain or tenderness to palpation, even if there's a structure that is damaged below the surface. So you want to palpate each vertebra with a certain amount of pressure. Is there any pain? Also make sure that your learner palpates the paravertebral areas on each side. Next is range of motion. Can you please bend forward, try to touch your toes? Very good. Come back up, bend backwards, and bend to the left side, and bend to the right side. Any pain with doing this? Wonderful. While the patient is standing, I look at their gait and do strength testing. Can you please walk forward and turn around? And walk back. And now can you please squat down? Squatting down and coming back up tests the quadriceps muscle. That is the L3, L4 spinal level. Can you walk on your heels? Very good. This tests the anterior tibialis muscle and the L4, L5 level. Now please stand on the left leg and raise up to your toes and do the same thing on the right side. And this tests the posterior tibialis muscle and the L5S1 level. Disc herniations happen most often on the L4, L5 spinal level, followed by the L5S1 spinal level, followed by the L3, L4 spinal level. Next, have your patient lie down on the examination bench, and now it's time to do a straight leg test. Observe your learner's technique and interpretation of the test. I'm going to lift up your left leg. You tell me when and where it hurts. And no pain. A positive straight leg test is pain radiating down the leg at an angle of 45 degrees or lower. Now I'm going to do it the other side. Any pain? This is called a contralateral straight leg test. A positive contralateral straight test is pain radiating down the effective leg when I lift the other leg. This is almost always due to a disc herniation. If you're worried about a disc herniation at the L3, L4 level, you need to do a prone straight leg test, looking for pain radiating down the anterior part of the leg. Now please sit back up and slide all the way forward. I'm going to test your reflexes. Please close your eyes and relax. The patellar tendon reflex tests the L3, L4 level. The Achilles tendon reflex tests the L5, S1 level. And last but not least, we'll check for sensation. And I often see my learners broadly stroke the leg and say, "Can you feel this?" This is neither very sensitive nor specific. It is much better to really check for the dermatomes. The L3, L4 level is on the medial side of the foot. The L4, L5 level is right at the web space between the first and the second toe. And the L5, S1 level is on the lateral side of the foot. Always make sure that your learner compares both sides. Do you feel this?
Yes.
Like this? This? Like this?
Yeah.
And this? Like this?
Yes.
An important part of the assessment is to comment on the learner's attention to the patient's comfort and well-being. Did the learner make sure that the patient was comfortable? Did the learner explain the different maneuvers to the patient? And this concludes the 10-minute moment for back pain. Thank you for watching.